Well, good evening, everybody. We will call this workshop to order at 5 p.m. Welcome to everybody. We will first start off with a pledge, so if you would please join me and stand. Well, thank you, everyone. So we have a little bit of a unique meeting tonight because there is a PD&Z meeting that follows this. So we first have a workshop. Once the workshop has concluded, we will step into executive session while PD&Z meets. The expectation is that PD&Z will conclude before we come out of executive session, but if for whatever reason there's a surprise and it doesn't, we'll address that when it comes. So for the budget workshop, we have discussion on fiscal year 2023-2024 proposed budget. Dan?
Thank you, Mayor. Yes, and obviously this is a special meeting tonight. We weren't normally scheduled to have a council meeting tonight, so we've got perfect attendance. So thank you all for coming in on your day off, so to speak. We want to continue with each department getting a chance to put their budget requests before you, and also more importantly, just kind of tell you about what their department does, just so you're more familiar with the organization as a whole. So for tonight, we've got two different groups that are going to talk to you. The first one is IT, and then the next one is actually going to be Chad from HR. He's going to talk to you about benefits, and of course they'll both be available for questions, and obviously we're here as well. So if we don't have the answer for you tonight, we'll write it down and get back to you. But first up is going to be Patrick, if you're ready. And as he's coming up, for those that don't know, Patrick has recently been promoted into this position, so another trial by fire like many of us. So a little bit of grace for the young man that is going to present tonight.
Thank you. Good evening, Mayor. Good evening, Council. My name is Patrick Beauchard, and I'm the IT Manager for the Information and Technology Department. I'd like to take this time to introduce the IT Department, talk about a couple of our high priority focuses and our focus moving forward. IT is responsible for implementing, managing, and maintaining the infrastructure and systems that support city operations. Some of our duties include overseeing network infrastructure, administering computer systems and databases, providing technical support to city employees, ensuring cybersecurity measures are in place, managing data storage and backup systems, managing telecommunication systems, providing training and education for technology-related matters. Specific responsibilities vary depending on need, but the overall goal is to ensure the secure and efficient usage of technology for city services. I would now like to take a couple minutes to focus on some areas that we deem as high priority. First is data security. Data security stands as a key priority for the IT department, commanding significant attention. The objective is to ensure that all city data is backed up on a regular basis to prevent any potential data loss and is accessed and controlled in a secure way. Currently, city data is backed up daily using industry-leading hardware to ensure accurate and secure backups. Backups include all server data, network share data, and end-user data. Additionally, all city data is controlled in such a way that it can only be accessed via direct connection to our internal network or via our secure VPN. In about 90% of our systems, authenticating using two-factor authentication is also required. Our next high priority item is cybersecurity. As an organization, we address cybersecurity in three primary ways: traffic security, endpoint protection, and user protection. Traffic security is primarily handled by our firewall. The City of Manvel utilizes industry-leading firewall hardware to monitor and secure all inbound and outbound network traffic. This device is updated on a routine basis to ensure all new types of attacks can be detected and properly addressed. In the past 90 days, our firewall has detected and blocked 659 potential threats from gaining access to our systems. Endpoint protection, also better known as anti-malware and antivirus. As a standard, all city computers are equipped with a cloud-based anti-malware and antivirus. When installed, the system embeds itself into the operating system to provide high-end protection. Since this system is cloud-based, it is constantly being updated with the newest threats and vulnerabilities before they ever make it to one of our systems. In the past 150 days, this system has detected and blocked 11 instances of potential malware. User protection. User protection starts with knowledge. Even with all of our safeguards in place, safe usage of the city's computer systems begins with the user. IT is continually evaluating and distributing educational material to keep users' minds fresh on the types of attacks that they should be looking for. This educational material may come in the form of an email reminder or enrolling staff in additional computer safety courses. As we continue to grow, IT will continue to refine the way that the training takes place and ensure all users are educated and are aware of threats. Now I'd like to touch base on a few things that we would like to address moving forward. Moving forward, the IT department wants to take a step back and focus on some internal improvement projects. Some of these projects include evaluating each system to ensure that we are utilizing them to their full potential, evaluating all IT processes for effectiveness. This includes equipment checkout, equipment assignment, crash recovery, to name a few. We would like to set up a proper asset management system to better track our assets, to track pricings, warranties, and information such as that. We would like to start working in a 4-year life cycle for all computer hardware. Life cycling computer systems on a schedule ensures that employees are not left operating on outdated equipment. We'd like to shift purchases to a set of standards. Creating a set of standards for city hardware not only increases serviceability, but also opens the door for better centralized management. Along with that, we'd like to set up proper endpoint management system, as well as expand our two-factor authentication integration into all city-owned computer systems. Keeping with the theme of this being part budgetary, I went ahead and put in one for budgetary request also. Currently, IT has no major projects that will require additional funding. It's clear that the City of Manvel has made many good investments in its IT systems, putting the city in a good place as far as data integrity and cybersecurity are concerned. I feel it is my responsibility to take an appropriate amount of time to evaluate the flow of the IT budget and ensure we are being good stewards of the funds that we are provided. And with that, I'm available for any questions you may have.
Patrick, appreciate that presentation and congratulations on your new role. Any questions or comments from council?
The two-factor, what did you say, two-factor authentication?
So whenever you go to sign in, you have an app that accompanies that you type in your original credentials. You then have to also authenticate on the app saying that you are in fact trying to log into the system you're trying to log into.
So it's additional software to log in?
Correct. It's an additional step, whether it be an app on the phone. There's different options for having key change that generate codes on a timed basis.
Okay.
Yeah, systems like that.
All right, so one more just really kind of silly question, but on presentations like that, is there any way we could have it linked to where you can see it on the desktop as well? Right, like you're linked to if you're on the network, right? And I don't know if there's a meeting software or whatever to share the desktop, right? Do we have that?
We could certainly find a way to do that.
That way, they're not turning around in an awkward position. You know, I'm just thinking of ergonomic type stuff, right? You know, it's a, is there something where they could be sitting there at their desk looking forward and at the speaker instead of turned around at the monitor?
Where there's a will, there's a way. I'm sure we could find a way to do that.
Yeah.
We currently have a project in place called VDI, they're virtual desktops.
Yeah.
And there was a incentive to put a VDI setup at each one of y'all's stations. Part of being in this role is figuring out if that's still the direction we want to go with that hardware that we have. If it is, you know, like I said, we could certainly find a way to do that.
I just think it'd be better for everybody at this table if you look down at your desktop versus trying to.
Right, for
Right,
sure.
and they're spinning around because there's the lights on the monitors, right, kind of gives a tough glow. So it's just my thoughts.
And I think Tammy has something to add to that.
So in your software, when you look up your agenda packet, the majority of them, when they're ready and they get them, we insert them. So every item that's in your agenda packet, that presentation would come up as well. So
I don't think mine would be in there.
it's just yours is not in there because I didn't have the PowerPoint, but whether it's a PowerPoint, a PDF, whatever file format it is, we can put it in that software that's already, you guys have access
Okay,
to.
yeah, it's just a thought. Thank you.
So basically, I mean, you want that screen there on your computer?
Yes.
Yeah, and I think there might be some value to that, especially if we're looking at plots or plans and Jessica or Joe's need to show us something. I know times in the past, everybody up here has been trying to figure out what Jessica's been looking at on the screen, and instead Jessica could have some control and show it to us on the screen exactly what maybe she or Joe's are referencing. So I would certainly be interested in exploring that.
We can do that.
Crystal, I think you had something? And thank you, Harry.
Great job.
Thank you.
Love that. I know that it's out of a lot of people's comfort zone to get up to a presentation in front of council or anybody really. It's like the number one fear of people in the world is public speaking. So kudos to you for that. I did write a note down on here about your data security and the city backup access. What type of measures do we have for redundancy's sake?
So the system we use takes daily backups. We also have a project in place for our off-site backup to where all of our daily backups will then be copied redundantly onto that other backup server.
Okay. Do we have anything off-site, like a data center that would house that in case we had something go down completely here that would offset that? Or do we have a double, just a redundant way to keep online services? Like if the city went out, I don't know, if whoever we use as our primary, if it's whoever that is, if the services go down, is there a fail switch or somebody that would kick in redundantly to be able to provide access?
And Patrick, before you completely answer that, yes, there is an off-site location,
Okay.
obviously for security purposes.
security
We're
purposes.
televising everything else, so.
Absolutely.
That's why I didn't name specific system names.
Exactly. We don't want to do that for cybersecurity purposes. Definitely, I get that. Just wondering, do we have an off-site data center that houses this redundantly where it's copied there, copied here for redundancy? And you said yes.
We have a project to get that up and running. It is
Okay.
not done just yet.
Okay, perfect. But it doesn't require any more money, right?
Correct.
So that's
It's already
good.
been
Right.
purchased. We're just waiting for parts to come in.
Perfect. Okay.
Yeah, the
And
location
then-
is there and everything's ready to go. It's just the actual implementation of it now.
Perfect. So if anything were to hit here, I mean, I know we have backup generators and things of that sort, but the phone systems, the internet, all of that good stuff, we have redundant measures.
Yes. We
To-
actually have 2 ISPs.
Perfect.
So if we lose one ISP, we have a redundant backup.
And does it have, I'm sure you guys have software to make that automatically kick in, or do you have to manually turn that on?
It is supposed to be set up to automatically fail over
Okay.
if we were to lose one. That's part of our internal projects that I want to do, is dissect that system, be sure that's operating the way it's supposed to.
Okay. And then, only because I'm new here and I don't know, our phone systems and our voice connectivity here, is that 100% voice over IP services, or is part of that still analog? Most likely not, but just wondering, because analog is always safer unless you have that redundancy built in there.
Right. To my knowledge, the only analog lines we have left are a couple of fax lines.
Okay.
Everything else is VoIP. If there's any standard phone lines left, I'm not aware of them.
Okay. Neither am I anywhere really, but just had to ask that. Okay, wonderful. Thank you for answering that. Appreciate you.
It seems like Crystal has a little bit of an IT background there, based off of her terminology and phrasing. I've got a few questions for the daily backups. Do you scan for viruses before you back it up?
I want to say that our backup system does look for any threats before it backs up our systems. However, our anti-malware, antivirus is on every single system. So I would say that we have redundant security measures in place for those backups.
Okay.
But again, a lot of this area is a couple weeks old to me at this point, so I'm still wanting to go through those systems. But
Yeah, I think I've had experience in the past where in a backup, a virus has slipped through the malware, and then it's in the backup, and then we have to restore from backup, and then we restore with the virus already in the backup, and it just spirals from there. So yeah, that'd be something good to check into. And so kind of talk to me about what's your process to evaluate our software? How are you approaching that?
a lot of it has to do with our backend infrastructure, how our backups actually occur. Is every day the good span for that? It can be modified every hour. What's our capacity? Are we using the equipment that we have to their full capacity? So my basic plan of attack for all of that is narrowing down a specific system, getting logged in, dissecting the current configuration, and just examining it to see if it's currently set up in the way that is best used for what we have.
Okay, that sounds good. You said 90% of our systems are MFA. What's the timeline to get the final 10%?
I don't have an exact timeline right now. I need to verify that there aren't any additional costs associated with doing that. I don't believe there are. It's just a matter of getting the client onto the machines. If that's all it takes, I mean, we could have it done in a matter of weeks, really. It's just a matter of installing the application.
Okay, because yeah, I think having key fobs or an app works. I'm familiar with also, calls being made or text messages with a digital verification code that has to work as well. So I think there's some opportunities that's there. So yeah, if you just can keep us updated on that timeline, that'd be great. What percentage of our softwares and systems would you say is on-prem versus the cloud? And I should have provided these to you in advance, and my apologies about that. So I take ownership there.
I want to say a lot of city operations software is cloud-based, aside from our Encode software, which is hosted on-prem.
Okay. And the reason I asked that, it leads into a second question for me, and I don't expect us to necessarily make huge strides in this area for this upcoming fiscal year, but for the next one, since it is cloud-based, I'd like to see us start to do some integrations with our software where we can feed data through APIs and, look to do SSO as well. Since everything's on the cloud, we can kind of feed into that. I'm not sure. Do we use Azure? Is that our backend?
We are we're on-prem for our full network currently.
Okay. So yeah, because I know that there's opportunities to leverage Active Directory based off of who our provider is, and so not sure who that is. So opportunities to do SSO, to integrate the system through APIs, I think feeding data would help streamline, at least from my perspectives, the sharing of information between different departments as things need to come into alignment. Instead of it being passed through paper or through email, it's passed automatically. So if there's opportunities there, I would love to see us explore that. The last question I have we ever done any sort of third-party risk analysis, any sort of penetration testing from an outside party to see what our vulnerabilities might be?
Before my tenure here, I believe it was done. I don't have any records of what the outcome of that was. I feel like that's something that should probably be addressed again here in the near future.
Okay. Yeah, I think that's, and I appreciate that. And while we might not do it in this year's budget, if we can make that a priority with the ever-changing environment that we're seeing here, I think it's important to do that on a regular cycle. I think it's doing internal risk penetration testing as well as external third party would be a great thing to see. Well, that's all that I have. Anybody else from council?
Just real quick.
Yes, sir.
So, again, good presentation. And so with all these things in place and where you're going to review the processes, is there a disaster recovery plan, like manual, in place?
Not a manual that I'm aware of.
Or, okay. So like if we had a Harvey or something like that where we had to recover, what would be the plan of action, or how would everyone know how to access it in?
That's part of our internal improvement that I'd like to do, is come up with those processes. that's part of evaluating our IT processes and making sure that we have solutions like that ready to go.
Okay, okay, thank you.
Well, Patrick, great job for a few weeks on the job. Appreciate it. Best of luck. And if you need anything from us, just let us know.
Thank you.
Thank you. All right, Dan, I'll turn it over to you for who's next.
All righty, so Chad is going to come up and talk to us about human resources. Again, sort of department-wide requests, and then drill down a little bit on benefits, specifically insurance and dependent coverage and those kind of things.
Okay, good afternoon, Mr. Mayor, Council. Today, I'm going to talk to you about human resources. Just to start off a little bit, my name is Chad Dumont. I'm the HR manager. Just to give everyone a little bit of my background, I've been in human resources for about 23 years. Prior to that, I spent 4 years in the United States Air Force doing supply management, supply logistic for the 53rd Weather Squadron with the Hurricane Hunters. As far as everything on the HR side, I've dealt everywhere from deep water drilling with drilling companies to power plants, chemical plants. There's not a power plant or chemical plant in Deer Park, LaPorte that I probably haven't set foot on at some point in time. What is human resources? Get that question a lot. You know, human resources provides recruitment, hiring, other office capital management support. This includes hiring agencies, workforce, managing benefits plans, providing professional development opportunities. Okay, that's very generic. That's very surgical. Something about human resources that I like to talk about is the people aspect. You have to be able to speak to people, bring them from a certain point to where they have an issue or they have a problem. They're at a level 10, you need to bring them back down. You need to calm the employee. You need to let them know that you have an open door policy. You need to let them know that someone is there listening. You can go ahead and recite policy left and right, but talking with that employee, explaining, letting them know that someone is there to listen to them, letting them know that someone is there to work with them, best benefit of them and with the city. We don't talk about that very much in HR. It's always, you're the benefits manager, you're writing policy, you're doing job descriptions. Yes, those are all great points. But the ability to handle situations when they occur, stressful or non-stressful. You may have an employee that may have an issue that for us may be small, but for them it's detrimental. And you have to treat that problem regardless with the same intensity. As I stated before, different areas, writing job descriptions, doing postings, job screening, interview process. That is something that I work very closely with each department on. Every department is different. Every manager is different. Everyone's looking for the right type of person. So we work very hard to make sure that we have all of those clarified. And during the interview process, we hit very hardly on exactly what we're expecting and then what type of employee we're actually interviewing. So it's a very, very important process. Next, we want to talk about our benefits plan, which is, I'm sure this has come up several times with the council. This is a lot of good information. Currently, we supply our medical, dental, and vision through Texas Health. That used to be TML. They recently changed their name. We also have a third-party supplemental insurance that we do through Next Level Urgent Care. Now, Next Level Urgent Care is 100% paid for by the city. This is $60 per employee. The employee can go to any one of the Next Level Urgent Care clinics. Everything that is done inside their clinic is 100% covered at no cost to the employee. They take care of everything from your general practitioner to your general ailments, broken bones. They do x-rays. They don't do MRIs, but they do x-rays. They do blood work and then preventive care. We work with all of our employees to have a physical done yearly, just to do checks to make sure that the check engine light isn't on and they're feeling right. This is at zero cost. So far, we did a little cost analysis as far as with our claims from 2021 and 2022. This is prior to Next Level and after Next Level. I apologize, they didn't get the whole screen, so that's just a little bit of a snippet. But our claims from averaging at around 41 employees was at a little over 4,700 per employee as far as average claims. Since we've added Next Level and we basically doubled our employees, that's down to a little over 3,000. So we've seen a cost savings as far as what we're being charged by TML to going to a standard hospital as to opposed to general areas being handled by Next Level Urgent Care. Benefits comparison. Find this information very, very interesting. We just recently took a look at the Houston-Galveston survey, and out of 42, as you can tell, I should have had my glasses on right now. Out of 42 cities, 30 cities list that they provide 100% coverage for their employees. Manvel is one of those cities. For our employees, we cover 100%. 25 out of the 42 cities provide some type of dependent coverage. 15 of those cities cover 0% for dependent coverage. Unfortunately, Manvel is one of those cities. We cover 0 when it comes to dependent coverage. Of the 25 cities that do provide, their average coverage is somewhere around the 71% that they cover. Again, we are currently at 0. Looking at our current plan, we have it divided up into 4 sections. Now, the city pays 100% for employee. When it comes to the next section, that's employee and a spouse. Then we have employee and children, and then family coverage. So when an employee starts with the city of Manvel, they're going to go in one of those 4 groups. If they just have a spouse, then it's employee and spouse. If they have children, it's there. The good thing about this, it's no limit on the children. You can have 1, you can have 99. That is one price for your children. Family is where it gets complicated. And I apologize, we just saw a mathematical error on there. The family coverage is actually costing the employee around $780 per pay period. So that's around $1,400 per month that employee would have to pay to cover their entire family. Out of the 89 employees we have currently, we have 6 that have selected that. Now, out of that 6, we have given them the option with our other plan to have a higher deductible at a lower cost. So it brings it down to about $1,200 per month, $600 per pay period. That is still astronomical. When looking at just the employee and spouse, an employee's paying around $309 per pay period. If an employee is looking at just covering themselves and their children, it's around $208. Reasonable, but still. What has helped us has been the Next Level Urgent Care. With the employees having that option to get things done that they normally see a general practitioner for, it has helped them from having to go to the doctor, paying those deductibles, paying those hospital fees, emergency room fees, or what have you. The proposed plan for next year with TML is a 10% increase from where we were. Actually, that 10%, the first time I heard it, I kind of jumped out of my chair. Then looking at what's going on statewide, TML had an average of 16 to 18% increase for 2023-24. Reason being has been COVID cost and other costs over the past couple of years has sort of been piling up. Last year, we received a 13% increase. So the 10 this year was really helped by our participation with the Next Level Urgent Care Prime, bringing down our cost. We do have secondary options as far as the proposed benefit plan for those same benefits. I'm sorry, we'll go back to that. For those same benefits to where we can offer the employees a higher deductible, but it's at a lower rate. So again, it'll cut down a little on what the employee is paying. But again, it's still going to be at around the 14, 13 range per month for a family. As far as an actual cost breakdown, and I apologize for this. Let's get it to where I can actually see. As far as the actual plan, we're looking at about a 10% difference this year. So costs, we're looking at around 308,000. That's going to be additional that we weren't paying last year. Now again, the two plans that we talked about, Plan 2 and Plan 3, there is a slight difference in pay, which is a little less for the employee and spouse, employee children, and then also the family. But again, we're still looking at an average of paying currently $1,111,000 just for our employees. Now, that's taking what we currently have and adding 10%. If we start looking at adding the employee and spouse, employee and children, or family, that cost could go up if we do full coverage anywhere from $1,900,000 to $3,225,000. That's looking at a 100% cost. Now, we will not have that total number because not every employee is going to select a family plan. There are employees like me, that is myself and my spouse. We don't have children. We're going to be at that rate. We have plenty of our employees that come across that are just the employee and they're supporting their children. That will be at a lower cost. But I can't stand here and give you a number tonight because the numbers that we have are currently skewed by what our current price range is. We have plenty of employees that have not selected family insurance, or maybe they haven't selected spouse or children because of the cost. If we were able to do something to help that cost, those numbers would rise. Did we? Okay, so I think we deleted another slide here. We do have a suggestion by staff. Now that suggestion is using dependent coverage as far as a step program when you hire into the city. We're looking at, for those employees from day 0 up to 5 years, 4 years, 11 months, 29 days, looking at a 25% cost by the city for their dependent coverage. By doing that, you'd be looking at currently our numbers of 89 employees. Currently, 71 of our employees have less than 5 years of experience with the city. So the additional cost at 25% would be anywhere from $28,000 to $48,000 on top of the $1,111,000 to add 25%. We're looking at once an employee goes from 5 years to 9.5 years, or 9 years, 11 months, 50%. At that, we'd be looking at 9 employees at anywhere from $7,000 to $12,000 to cover them at 50%. And then once an employee reaches 10 years of service, that's when we would look to add at 100% coverage for dependent care. That would go for our 9 employees at $14,000 to $24,000. Those numbers are going to be pretty steady for the next 6 months. We have 2 employees over the next 6 months that will go from 0 to 4 to 5 years. So the number for the 50% would go up a little bit. But on average, that's what we'd be looking at if we decided to go with a STEP program. I can't find any other city that's doing that. They're either doing their set percentage for each employee, but I believe this would help us as far as fiscally slow stepping to where we're not taking a $3 million hit right off the bat. This would help us slowly get there. It would show our employees that we are taking steps, and at least with the 25% coverage, gives our employees some help when it comes to dependent coverage. Is that our last slide, or is this not working here? Oh, the battery's running low. There we go. Okay, so now for the fun stuff that we really were going to talk about today is position request. As we all stated the other day, Human Resources is a department of 1. We're currently at 89 employees. Once we're fully staffed, that will be at 98. When we look at the metrics as far as the Houston area with HR coverage, normally anywhere from 100 to 125 is your max number per one individual. Each department, normally when they hit the 100 mark, they add an additional, it looks like we died there. That's okay. Normally, after 100 folks, you add a secondary person. Currently, we are handling things at 98. It gets stressful at times, but again, we are doing things as we need. As we continue to grow, and as we continue working more with benefits and being there for our employees, I would like to see an additional 1 person as far as either an HR generalist or a benefits coordinator that can work in conjunction with the HR manager to help with data input and to help with answering questions from staff as far as when they're changing their coverage, when they're changing their address, what's the best options for life insurance, things of that nature. The last thing that was on my budget was as far as annual training for HR. I am a firm believer in the SHRM and the SHRM conference. This is something that I try to do each year. There's a total of 4 conferences. I try to go to one of them. There is a cost to that, and it's at around $1,500 for one person to go to this. I think it's very important that each member of HR goes to this training each year to learn about new federal laws, state laws, employment compliance, status trends. It's very good information. So I would like to see in the budget, I think we've got it at around $6,000 as far as SHRM membership, SHRM conferences, and travel as far as that. And that is what I have, and I'll be more than happy to answer any questions.
Well, I appreciate that, Chad. Definitely a lot of information that's there.
Yes, sir.
But you did a good job summarizing it. I'm going to want to dive into the numbers a little bit more. And so if we can have access to the presentation.
Yes, sir, we'll get that to you.
And then also any raw data that you're able to provide, of course, with any personal information not included. Would kind of like to look at the numbers.
Sure.
I have some clarifying questions before opening this up to council. For the next level coverage, is that only for the city employee, or does that $60 a month also cover their entire family?
That is a very good question, and actually, that is something that I should have brought up. That is for the employee and all of their dependents. So again, you have, we've had several employees that have recently had newborns. We're able to put those dependents on from the day they're born. So if they have initial appointments, if they don't have a pediatrician that they're normally going to or what have you, they can go to Next Level Urgent Care and get this coverage at zero cost. The only cost where you need your insurance is if there's an issue that they cannot handle inside the clinic. When it gets to MRIs, when it gets to you need to see a heart specialist or something of that nature, that's when you have to use your insurance. But yes, dependent coverage is covered in that $60 cost per employee.
That's great. That's great. Maybe one day we can get a next level here to Manvel.
We are actually working with that. They are trying to get one sometimes either by the end of this year or sometimes next year.
Awesome. That'd be great. Do we have to use TML for health insurance?
We do not.
Okay.
TML has been the standard. As we talked about during the last council meeting, just like when it comes to sourcing firms, there are plenty out there. We can go with a lot. TML is one of the biggest that is out there. They have a lot of coverage as far as if anything happens on the audit standpoint. They have a very big staff that can go in and help you move around things in their portal. We can look at other agencies. In fact, we have one that we're working with right now just in case. Again, we probably will have a cheaper rate if we go with a different agency. The only thing that I would caution is that sometimes, you get what you pay for, just like with insurance. They would put this out to market. They would get the best price. Maybe this would be something that they were able to work with Blue Cross Blue Shield or Kelsey-Seybold and work into those same parameters. I worry about what will happen, not after year one, but what happens in year two, to where we get a great rate to start off with. And then just like TXU or one of the energy companies, after a year, suddenly that kilowatt rate goes skyrocket. So that's just a worry that I have. But we are in the process of working with another third party as well, just in case we do decide to go with something a little cheaper.
And I'm not sitting here advocating that we go away from TML. I'm curious. I'll be curious if in the future, if we can just look at what would that actually be? Just because I know that in the private sector, you can shop around your insurance, and my family and I, in full transparency, we don't have health insurance because it's too expensive for us. We can't make it work within our budget, which is difficult and it's challenging, but that's just what we have to do. But the company that my dad works for him, my mom, and then my two brothers, when they were under 25, they paid for per month $300 for full coverage. But I also understand, this is where I'm very naive, I guess, within the government world of health insurance, that there's different standards, there's different requirements, I'm sure, that are different than what the private sector might have in regards to shopping health coverage.
Yeah, we'll be more than happy to look at that.
A few more just questions here. You mentioned of the HGAC cities, you looked at 42 of them, 25 cover some, 15 cover zero, Manvel being one. That comes up to 40 total. What do the other two cities cover 100%? Not sure if you, and it's not,
And I apologize.
I think there were,
for this.
those were my numbers, I think. So there were two that did not cover 100%. It was a different percentage for the employee, and that's where the two different ones were.
Gotcha.
So the 15, I think it was 100% for employees. I thought you're giving me the hook. I just started. Sorry. Yeah, so the 15 number was 100% for the employee. And then there's two other ones that, for whatever reason, I think they're 80%. I'd have to look, but it's something less than 100%.
gotcha, okay. Chad, you mentioned training, the $1,500. Is that something the city hasn't covered for you in the past?
Actually, they have.
Oh, they have, okay.
Yes.
Okay, because I just wanted to make sure we continue to do that, and if we haven't done it, I do think that we need to do that.
Yes, sir, and the reason I bring it up is if we do decide to bring on a second individual, I would like to be proactive and have that person have that ability to have that training as well.
Great. Last question that I have, and then we'll open it up to council here. When you had mentioned the staff proposed solution, doing a STEP program, have the employees been polled on what their opinion is on that?
We have not polled the employees strictly because I don't want to give any false expectation as far as what we're looking at. That's why the numbers that I gave you as far as the 89, breaking it down by seniority, I can only give what our employees currently have. If we were to give more, I think those numbers would go higher. But this was just kind of a suggestion inside. This has not been something that we've passed around to all the employees to see, yes, we're good, or we want more than 25%, or what have you.
Absolutely.
That's something that we can do.
Yeah, I mean, it might be something worth considering to get their feedback on this, because they're the ones that are directly impacted by this decision. I personally, I like looking at doing a STEP coverage program. I think it incentivizes longevity. It allows us to leverage the growth that the city is experiencing in order to help cover this. My initial thoughts, and this is just for myself thinking, 5 years might be a little bit of a long time. Maybe look at doing the 2 to 3 year mark for that first step instead of the 5 years.
Sure.
Would be interested in kind of seeing, okay, if we adjusted these numbers a little bit, what would that financial impact be?
And sir, looking at this, we went very conservatively just to put this in front of council to have that conversation as far as, does it have to be 25%? Maybe it's 15, maybe it's 30, maybe the years can be pushed up and down, but just some general parameters for us to look at.
No, I think what you put together is great. It's a great starting point for us, and I appreciate your work and your effort that you've put into this amongst everything else that you're juggling at the moment, so thank you for that.
Thank you.
I'm assuming that we're definitely going to have comments and questions from council, so David, we'll start with you first.
Thank you, Mayor. On that last point, that's exactly the point that I wanted to say, that I would love to see the STEP program a little more aggressive, you know, on percentage, not waiting 5 years and whatever, but if we can't make it a shorter term period. And then also, maybe not understanding, you know, insurance is frustrating. You know, every job you go to, and then a few years down the road, they want to change, you know, the insurance company and blah, 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 because of rates, whatever. And then there's different benefit packages, or, you know, your deductible package, how much deductible. So with this STEP program, can you also maybe look at different deductible rates for the family, or what? I know that's just kind of muddying the water, bringing another factor into it.
Actually, sir, that would not be a problem because we're currently doing that now with our policy. We are able to have our standard rate, and then the employees have an additional to where they can have the same coverage at a lower rate but at a higher deductible.
Right.
So we would be able to do the same thing even in a STEP program.
Right. Okay. Thank you. Good presentation.
Thank you.
I guess the main thing I want to say is, when I heard those rates for the employee family coverage, it gave me heart palpitations.
Yes, sir.
So I really hope that this is something that we can keep as a priority, where we're examining and looking at whatever alternatives, such as that STEP program. And I agree with David and the mayor, the more aggressive program. it stopped the palpitations, at least when I heard the clarification that at least they can go to next level care. But I know that when you get into that specialty care, you know, how devastating it can be if you don't have that coverage.
Yes, sir. And it has helped us as far as on the recruiting area. When we mentioned that as far as this is something for our employees as far as next level, it took about 6 months for our employees to really get a full understanding as far as what next level was. So the numbers weren't quite high at first, but as we've steadily progressed, more and more participation. We've had more and more employees go in to get their physicals done, see pre-existing conditions that they didn't realize they had, and get on medications or what have you onto a wellness program. So
Okay.
we're seeing a lot of benefits.
So it's
with
been
that.
good for preventative care.
Yes, sir.
Okay. We've got work to do.
My turn? Yay. Okay, so I have a few questions. That is a phenomenal benefit to have next level urgent care for $60 cover an entire family.
Yes, ma'am.
That is powerful, 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 powerful. I'm wondering how many of our employees are actually utilizing that?
So that is a very good question. We get a presentation from Next Level every 3 months.
That's amazing.
And we have been averaging right at around 51 to 56, I don't have the number right in front of me, employees per 3-month period that are utilizing some aspect of the program. Now, that may be medication, that may be teledoc, that could be going into the clinic either for a wellness check, a cold, a cough, COVID test. There's a myriad of different reasons. But our overall employee population has been utilizing Next Level.
To me, it sounds almost like it would trump the standardized coverage if it wasn't for that. I mean, it's mind-boggling, $60 a month. What's the cost for the city to cover that?
$60 per employee per
And do
month.
they have to pay anything out of pocket for that?
No, ma'am, we are paying that.
100% coverage, and they
100%.
get access to an urgent care facility.
Correct.
Okay, so with that being said, I mean, it's mind-blowing. It's absolutely mind-blowing how powerful of a benefit that is. I don't necessarily agree 100% right now that the STEP program, when we're talking about health benefits, is good, although I am a huge proponent of stepped incentivization for attracting quality candidates, workforce, human capital, all of that, part of compensation packages. I think that I want more. I needed to simmer on that a little more, look at some numbers and just kind of weigh that and see what, just, it's a good starting point is all I'm saying. I like that. Sure. But I kind of feel like this next level urgent care is top notch. It's phenomenal.
We have been for lack of better terms, the test case for this area. Manvel was the first city to adopt it. Since then, I want to say that there's 2 or 3 other cities and 1 school district that is looking, and they've either signed it or they're close to. I've had several conversations with HR directors on the benefits.
Okay.
And ma'am, I will tell you that I was the world's biggest skeptic when this was presented. I felt this was just too good to be true, and there had to be some devil in the details. But we've been part of this program since January of '22. And I've had maybe 1 or 2 minor complaints from employees as far as customer service here, or, they could have done a little better job on this, but overwhelming, it's been positive feedback from
Wonderful.
care.
1 or 2 is nothing. The next question that I have is, do we have any examples of missed work or productivity from staff based on not being able to provide health services to their spouse or family? Initially, that was one of the questions I had here because of the lack of availability to cover your family. I mean, when you're making the salaries and then you weigh in coverage to plus deductibles, plus all of that, we were supposed to have Affordable Care Act, which I don't see really affordable in any manner at all. But when I look at this, I think of, okay, so how many people are actually missing work, struggling to get here because they have to care for their families and they can't provide care, so they're stuck at a clinic with 5-hour waits. But really, this urgent care, next level urgent care, I would assume that is filling that void, right? And people are actually using that, and it's not really hurting productivity?
So to answer your question, I don't have any data on that.
Okay,
No employee has come up to me giving me that reason as to why they couldn't come to work.
okay,
I've received that reason as far as why I'm looking for other employment as far as dependent cost. But when it comes to next level urgent care, you don't just show up at their clinic. There's their app that you go to. It's called their Prime program. You talk to a physician, they let you know, okay, do you need to come into our clinic, or maybe you do need to go to an ER or to a hospital, and they give you an appointment time. And from that appointment time, you'll be seen within about 5 minutes. I've personally been there about 5 times, and I've never waited more than 2. And that's something that I talk vigorously with our employees about their experiences at Next Level, and no one has ever told me that they had to wait any exuberant time in their clinics.
that's all I have. I think that answered my question for the other component. I have other questions here, but for the sake of time, I think we can go behind closed doors and ask those. Thank you so much.
Well, Chad, we appreciate your update. And to speak to Crystal's point, regarding the step system, maybe we do look at, and this is just throwing it out there for consideration, where all employees start off with a certain percentage coverage of dependent pay. Instead of starting at 0, start at 10 or 15, and then you step up from there. Because one of the things that we're asked about a lot is what's the most valuable asset that Manvel has. And it's the people. It's the people out there in the community. It's our city employees as well. And so whatever we need to do to make sure that they're taken care of, I want to make sure that we have all the options on the table. That way we can partner with staff and we can come to a decision that best serves the interest of our most valuable asset. So thank you for this information. I appreciate it. Good job. So I think what we have next is we have an executive session. So what I'll ask for council is if we can just make sure to pick up our items for PD and Z. That way they have their space here. And then Chad, I believe you'll be joining us in executive session along with Bobby as well. So City Council will convene into executive session pursuant to Texas Government Code Section 551.074, personnel matters to deliberate the appointment, employment, evaluation, and duties of a public officer or employee city manager position. Council is going to convene into executive session at 5:58 p.m.
Okay, good evening, everybody. We'll go ahead and start this session of the Manvel Planning Development and Zoning Commission. It is 6:02. We'll start with roll call. Brian Miller, that's me, I'm here. Kyle Maraskin.
Here.
Marianne Atkinson.
Here.
Kenneth Haynes.
Here.
Christy Kennard.
Here.
Dorothy Wayne is out sick this evening, and Mohammed is not here at the moment. So if we'll stand for the pledge, please.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. Texas.
Okay. Thank you. And Miss Tammy, do we have any public comment cards? No, ma'am. Excellent. First item up tonight is our consent agenda, which consists of a final plat for Meridiana Detention Reserve J2 and a final plat for Meridiana Detention Reserve H2 Phase 1 and our meeting minutes from last time. Has everybody had a chance to review those? Anybody want to pull anything out or discuss anything? No? Any motions in?
Motion to approve the agenda, consent agenda.
I'll second.
All those in favor? And the motion passes, what is that, 5-0? And onto our regular agenda. We can skip agenda item A, is that correct? Since we have no conditional approvals and, yeah. And then, so agenda item B, consideration possible action to approve excused committee members' absences. Motions?
Make a motion to excuse member absences.
A second.
All in favor? And that passes 5-0. And one final motion, please. I'll second that. All those in favor? And motion passes 5-0. Thank you, everybody. Have a great evening.
right, council is back from executive session at 7:01 PM. And now I think, I don't have my agenda on me, but I believe that we just have mayor and council comments. Any comments? Thank you. No comments. Okay, Councilman Akery just had to step away along with Councilman Perry, which is why they're not here. So I will make a motion to adjourn. Do I have a second?
I'll second.
All right, we have a second. All those in favor? All those opposed? Motion to adjourn passes unanimously 5-0. And we are going to call this meeting to a close at 7:01.